I don't know how many calls, text messages, emails that I've had over the last month, 2 months, where moms are just calling me and they're like, I have no milk. Why don't I have milk? And it's like the same conversation that I have over and over again. So I was like, we need to do it. We need to do a talk about this. So, and I think that when we talk about how the body makes milk, it really helps moms understand the whole process and why it is so important to make sure that you are having stimulation. Some moms will do bottle feeding in the hospital and then go home and try to start breastfeeding and wonder why they don't have milk. So it's super important that we, talk about this, because how things go the first couple of days really determines what your journey is going to be long term. In my practice, that's what I found. So when you guys are pregnant, your estrogen and progesterone level is really high, maintaining pregnancy. And as you start to get towards the end of your pregnancy, third trimester, some of those hormones are starting to change, which is why you might see colostrum, or you take your bra off at the end of the day and it's sticky. You have like a little crusty area over top of the nipple. Your body is kind of starting to have some of those hormonal changes. The hormone that makes milk, which is prolactin, is in your body all the time, which is why moms who adopt or do surrogacy, it can actually induce lactation, because your body makes it, but we have to tell it needs to be told to do so. It kind of stays dormant in your system until it's triggered. So you deliver the baby, you deliver the placenta, and then you have a huge fluctuation of those female hormones to where they drop. Well, by those dropping, it counteracts that prolactin level, which is that milk making hormone, and it makes it, it like skyrockets. So it's really, really high right after the baby's born, which we tell moms that's why it's so important to get the baby to breastfeed within the first hour, because in the medical term, we call it a bolus. You're going to have a whole bunch of colostrum right away after the baby's born because of that huge fluctuation of those hormones. But in order for it to stay elevated after that point, it's got to be told to do so, whether the baby breastfeeding or by you pumping if something happens that the baby's not able to go to the breast to feed. I kind of tell moms, think of it like a hamster on a hamster wheel. As long as the hamster is running, the wheel is going to keep turning. So as long as the breast is being stimulated, the hormone is going to keep moving to where your body will continue to produce milk. However, if there is a change within that, say baby's not feeding well, baby's not doing a good job at the breast, and mom's not getting adequate stimulation, or when you're pumping, you're not pumping properly, or say you're doing some breastfeeding, some bottle feeding, and you're not getting that consistent stimulation, well, then the process starts to slow down. Okay. By that process starting to slow down, basically what you're telling your body is, I don't have a baby here feeding every couple of hours. So I'm going to slow down the production and only make what you're telling the body it needs to make. So that's where moms will start to call me and say, well, I'm pumping twice a day, but I'm only getting 2 or 3 ounces. Well, if you're only pumping twice a day, you're only telling your body that it needs to make milk twice a day. However much is taken out, or how often it is taken out, is how often it is going to replenish. Okay. So if I am breastfeeding every 2 hours, whatever milk is taken out during that 2 hours is what's going to get replenished. And that's how often it's going to get replenished. Again, anytime there is a roadblock, things can kind of happen. So when we look at, lactogenesis is just a big name for, when we talk about the science behind it, the basics of it is milk production. So when we look at, lactogenesis in general is your body's way of producing milk. And then lactogenesis has lactogenesis 2 and lactogenesis 3. It goes through different processes. And basically what that means is colostrum, transitional milk, and then your mature milk. Okay. However, also, if there is some type of complication, say I mean, there's many things that can delay lactogenesis. So say that, a mom is an induction and it's a long induction, several days. Mom's getting tons of IV fluids, had an epidural for a long time. We pushed for a long time. You had a postpartum hemorrhage. You had to have a C-section. You lost, like I said, a lot of blood or blood pressure or any type of medical risk factors prior to even pregnancy. All of that can kind of hinder milk production.
Mm.
So, ideally, what we want to make sure is that moms know the process. You should have that colostrum the first couple of days, and then it should start to transition to transitional milk. And then your mature milk should start to come in at the end of like around day 5, but it'll continue to establish over the next couple weeks. If you don't feel like you're going through that process, or the baby is not feeding well, or there's been some type of major issue, always initiate pumping. We tell, ideally, again, pumping is not something that we really want you to do until breastfeeding's been well established.
Mm.
But I think that we have driven that so much into moms' heads that most of the literature, they say, it says don't pump for a good 3 to 4 weeks. Don't pump until breastfeeding's been well established. But if I have a baby who's not feeding well, they still assume that it's not okay to start pumping. So if things aren't going well, baby's not doing what they're supposed to be doing, making sure that you initiate pumping, because we have to still stimulate the breast to kind of compensate for what baby is not doing. So super important that you make sure that you do that, and also make sure that you're reaching out to a lactation consultant.